It is a great day and a great day for a celebration. Today, a national spotlight is being shined on Louisville, Kentucky, and 6 other winning communities across the country. That light is being shined by the Robert Wood Johnson Foundation, and we certainly are honored. The Robert Wood Johnson Foundation is the nation's largest funder and largest philanthropy solely focused on public health. What's more, they are seen as a leader and a lead innovator in engaging people in leading their healthiest, longest, and most productive lives. I am Tricia Finnegan of the Community Foundation of Louisville, and it is an honor today to welcome a few of the key partners that have been working diligently to secure this honor for Louisville, Kentucky. The process of securing this prize, the Culture of Health Prize from the Robert Wood Johnson Foundation, is their largest national honor. And the Culture of Health Prize recognizes and elevates communities that are demonstrating deep commitment and great progress toward allowing their citizens and residents to live and create their best possible life. I offer you a sincere thanks for joining us today and share with you on behalf of the collaborating team that it is our sincere hope that today will inspire even further work and engage additional community partners in the work that is yet to be done. To speak more about this, I offer a sincere and warm welcome to our mayor, Louisville Mayor Greg Fisher.
Well, thank you and good morning to everybody. This is a very exciting day for our community. It's always nice when people recognize the good work that we've been doing, and we always think we're doing good work, but when we get the national recognition, it kind of says good job for everybody. And this is really a wonderful continuation of the work that we've been doing in the community around establishing the culture of health in everything that we do, and we made that even more specific when in 2011 our team took office here and said that one of our primary goals is to make Louisville a healthier community. Physical health, mental health, environmental health, all aspects of health. And that does not happen, as everybody knows, by any one person. It only happens when you have tremendous partners that come together. And that's one of the things that Robert Wood Johnson is recognizing here today, this wonderful collective impact that we've had in our community and continue to have in terms of people from all parts of town, all disciplines and professions coming together and saying this culture of health and equity is super critical to our city. So because health is a big community-wide challenge, to affect results on it, we need a community-wide response. And I'm really honored that we have these type of partners that continue to step up here in our city. We've got a long list of committed people and organizations that includes Tricia Finnegan with the great work that the Community Foundation is doing, and Susan Berry, thank you as well. Sadiqa Reynolds, the judge of the Louisville Urban League, who is bringing a super solid work to the Urban League, thank you, here locally and nationally. And then innovators like Theo Edmonds, Josh, and the folks at Ideas that have really kind of added a new level of excitement and a new dimension to this work that has captured people's imaginations internationally. So thank you for that good work, Theo. And we're honored that once again to include Robert Wood Johnson. We look at them as a partner that's supporting the work that we do here to make us a healthier city. As one of 7 winners of their Culture of Health Prize, I think it's another thing that we can point to in our city of the real positive momentum and the renaissance that we've gone. We frequently are talking about the renaissance of the built environment that we have here, but you can also see the renaissance of the spirit of the community through efforts like this. Because one of the things these collective partnerships do is they oftentimes introduce people to each other that have not met each other before. And this is really the strength of a community, when people look at each other as brothers and sisters, as partners, whatever term we want to use, as opposed to some kind of other, you know, from a different part of town. When we see each other as brothers instead of others, that's how cities and communities do good thing, and sisters too, Judge. All right. 200 communities applied for this prize. So that is quite a testament to the partners that we've brought together here. One of the things that we take for granted in Louisville, now that I've been mayor for a little while and I talk to mayors from other cities, is we have this ability to work as a team that we shouldn't take for granted. You go to other cities and they really struggle with working with different organizations, even different functions within inside of the organizations, and the individual egos seem to be more important to them than the collective good. And that's why we frequently are getting recognized for the work that we do in our area. And I think we do that because we care about the folks that we're serving. And that's the goal. That's not the individual goal of any one of us. It's this collective good for the city. And I think in this time of kind of fractious division that some folks are trying to sow in our communities around the country, it's really important that we lead the way from a city level about how people can work together, regardless of what you look like, what God you worship. We're all in this together. Now, Robert Wood Johnson is pretty clear, too, when they give you this. They're recognizing a couple things. They recognize that the basis of all of our actions is that we're committed to equity in health, just like education and economic opportunity and everything else, because every child in every neighborhood should have every chance to realize their human potential. And we all know around the country, too often, the zip code that you're born in determines your destiny. And I know that's not acceptable to anybody in this room, so we should not allow that as an acceptable outcome for any of the kids that don't have a voice like we have, that can participate in here or stand up here and speak today. And so that's our job to make sure that that is the case in our community. And Robert Wood Johnson obviously understands the importance of that as well. To do this, we've got to have good data to help us make decisions. And we've got to make continued progress around that. We've got to have that data open and accessible so people can see it. Sometimes it points out some inconvenient truths. That's good. That makes us act with a higher sense of urgency. But it also draws more partners into the work. One of the things about this work we do in the public, as we know, is that different people enter at different times because they've got to be ready to enter the work. And sometimes they're very closed about what a problem might be, but continued exposure to data and personal stories sometimes then gets through at different times. And that allows us to expand the number of people that we have working together. So sometimes it's easy to get impatient with people because they don't get it, so to speak. But our job as teachers is to continue to expose them. Be patient, be persistent, and then oftentimes we see people then starting to become allies on this work. So that's why it's so important that we have not just the data, but then the collective impact model where you bring people and organizations together to take on big challenges, like the Healthy Babies Louisville initiative, a reminder that we had a couple weeks ago, Dr. Moyer, with your beautiful child there. I heard a lot about that later in the community. Whenever we have babies at things, you know, the media really follows up and people talk about that. So when you think about the big initiative like our Cradle to Career education initiative, Say Yes, that we'll be talking about more as well. Some of our Office for Safe and Healthy Neighborhood activity. Rashad's here with us today. We cannot get these done if we don't work together in a big collective way. So we've got that work, and then Robert Wood Johnson also really is impressed by the innovation work that we do here in our city. We know that we've got to be good not just at delivering daily work, but also at improving that work, but then having these breakthrough moments as well, breakthrough or innovation, that we call it. And that really excites people when we discover new ways to have people work together or commune together. The arts program that Theo will be talking to you about soon, the Roots and Wings activity that has been going on in our community has been awesome in terms of bringing people together around the arts in a way that shows mutual appreciation from the arts from people from totally different backgrounds in different parts of the city that all of a sudden leave these events as newfound friends that we've seen now continue to work together on other very critical projects in the community in terms of community building. So the arts is one way that we bring people together. And then another is through citizen science. Ted Smith is with us here today. Ted has been really the country's pioneer in this whole concept of citizen science. We've been fortunate to have him here in our city leading that effort. So you take a program like Air Louisville, which helps our citizens with asthma breathe easier. It's become a national model When you think about the Internet of Things, everybody's familiar with that, and you think about all the sensors that gather data, probably the most dynamic sensor that we have in our society is the human. So Air Louisville equipped about 1,000 human sensors where the GPS device was put on their asthma inhaler, so we know where people are having difficulty breathing now. And we've applied metrics to that for mitigation attempts, individualized medicine approach to that as well. And the country hadn't seen work like this before. So Robert Woods Johnson Foundation is a very big fan of the work that we've done here in our community on Air Louisville. And I want to take a moment to thank Ted Smith, who served for many years as our Chief of Civic Innovation up to about 2 weeks ago. He's re-entered the private sector. He co-chairs our new Innovation Advisory Council for the city, but Ted has been a national pioneer on this work, and we've benefited from that here in our city. So Ted, thank you very much for your good work. See, people don't recognize a prophet in his own hometown. But thanks, Ted. I recognize you. All right. So this is who we are here in Louisville. We work together. Again, thanks to the Robert Wood Johnson Foundation, and this isn't the first time we've been recognized by them. In 2013, Robert Wood Johnson Foundation held their National Healthy Kids, Healthy Communities conferences here. They also awarded us a Healthy Kids, Healthy Community grant as well. So it's really great to see that our Healthy Hometown movement get all this recognition and continued momentum that we have here in our city. So thanks again to Robert Wood Johnson Foundation, to all of our teams here at Metro Louisville, especially our Department of Public Health and Wellness. I don't know if Dr. Schulte is here today, but our Department of Public Health and Wellness gets after it, I guess is the best way to say it. And I love your all's steadfastness, and you're in a super dynamic department. You've got to deal with literally, people every day with all of their wonderfully dynamic challenges that they bring to you. But you guys never back down, and you're always thinking about creative ways to get after it, and you worked really well together as a team. So I really appreciate your all's good work as well. Congratulations to everybody.
We're just going to cue up the video that Louisville submitted on behalf of our community so that you can get a sense of the broader group of partners that have played a role.
Louisville is a city rich in heritage, burgeoning with opportunity. Collectively, we are working to create a culture of health where the voices and needs of all citizens are valued and supported. In 2011, the Center for Health Equity report revealed health disparities across Louisville, including a 12-year difference in life expectancy between neighborhoods, expanding educational achievement gaps, and stagnating wages. In 2013, violence was a wake-up call heard by all. As a city, we came together. Artists, businesses, Metro Louisville government, and nonprofit organizations. Every sector stepped up to make change happen. Together, citywide, we begin to address issues.
The reason we're here is because this neighborhood and this community and this school and you matter to us.
Black and white, rich and poor, identifying neighborhood by neighborhood, community-led, policy-oriented solutions. Our clear goal? To alleviate inequality. As a community in the top tier of jobs that pay above a living wage. As a community striving to make educational opportunities available to all. As a community in which all people have access to healthy foods, safe spaces to play, and affordable housing. Reliving these memories as we gathered archive footage from our partners, we are proud of our progress. Ours is a story of innovation, failure, and collective triumph. Our culture of health is defined by a human-centered process led by our citizens, and every day we get stronger and healthier than the day before. From Shawnee to Smoketown, from the Highlands to Shively and Anchorage, one Louisville, one goal, a culture of health equally accessible to all.
Well, thank you very much, and thank you, Mayor Fisher, for your leadership, but also your deep commitment, not only to our community, but but I think most importantly to the individual lives that make up our community. With the context of both the city and the prize shared, I have the pleasure of providing how we got to this win today. The road to today started well over 16 months ago and has been a steady and focused effort across that time. What motivated the collaborators to pursue the prize was a unified commitment. That commitment was to health for every resident. We wanted to put our community's efforts and practices to the test. We wanted to validate what we're doing well, and we also wanted to learn from challenges where we know we still have room to grow. Moving through this rigorous process, being assessed by top experts from across the country, has sparked new thinking, expanded dialogue, and inspired even further partnership. And we certainly have received strong validation that our efforts are beginning to be successful. Securing the win places Louisville in an elite group of 7 winning communities. That group represents less than 4% of those communities of every size that applied from across this country. What's more than 200 individuals and organizations, many of whom are in this room today, are the partners whose work has been featured and whose work every single day has contributed to this success. It is the work of these partners, those building our communities, those rectifying inequities, those creating new opportunities, that have so steadily worked through our community, for whom we have secured this honor and these additional resources. We call attention to our nonprofit, corporate, startup, civic, community partners, as well as grassroots efforts, community-led initiatives, and individual residents, all of whom are linking arms, joining together to make better health for all. This is about nonprofits collaborating versus competing. This is about corporations moving beyond numbers, beyond their walls, and into community. This is about entrepreneurs, social entrepreneurs, questioning the status quo. This is about university partners and policymakers. This is about data nerds coming together. This is about people listening to the community and its needs in driving the solutions that they're developing. This is also about funders and philanthropists aligning their priorities, their funds, and their hearts with solutions that are creating meaningful change and committing to addressing key challenges. We work each day at the Community Foundation of Louisville for a community where people and place thrive. And we salute our partners in this room who have so passionately joined us on that mission. I acknowledge each one of you, and I invite one of our partners, Sadiqa Reynolds of Louisville Urban League, to step forward and share her thoughts with us.
Hello. Good morning. Thank you, Tricia. Thank you so much for all of your wonderful remarks and your work to get this done, to bring all of us together. Thank you all so much for being here. This is an exciting time in our community, and thank you to the mayor. I really do appreciate the remarks. Thank you for allowing me back into the building. You never know. You never know. So I was asked to be here to talk about the meetings that we had with Robert Wood Johnson and some of what they highlighted. And we are certainly winners in this community, and we should celebrate. But they asked me to remind us to keep that celebration in context and to really talk about why health matters to individuals and families and why we're really focusing here on health equity. We have to be reminded of the social and economic barriers that really are real in our community and across the country. And so while we are winners, we cannot take that winning for granted, and we are sort of being compared to other folks that aren't doing so great. And so we do have to think about that. And I just want to talk a little bit about, you said something, questioning the status quo. And that is what we are really going to have to do here in order to make this work real. What Robert Wood Johnson did notice when we were in the room is that we tried very hard to make sure there were people of color represented in the rooms. And then what they did was something I had never seen anybody do before. They asked for people's job titles. And when they asked for those job titles, they sort of figured it out. that the community people were the people of color, and that the folks with the titles and the power to push the policy changes were not. And so Louisville, as you celebrate, let's be real about who we are, what we're really committed to. We cannot let this conversation stop with the celebration of the award. This is really a time for us to do what we are so great at, and the mayor highlighted. We are so great at working together. We are so good at getting it done. What we have to be intentional about is who we invite to help us get it done, whose voices are heard. We have to make sure that we do that. And we have to continue to engage those voices that aren't normally tapped. And we've really tried hard to get a lot of good folks into the room, lots of different perspectives. And so we can't let those folks go now that we have the award, and I think that's going to be really important. When I listen to the mayor, and I worked for Mayor Fisher for so many years, I have so much admiration and respect for him and the city that he is creating and that he wants to create. When you think about compassion and all of the things, when you think of the potential of who we could be, the reality is how we get there is to really be honest about what is not right with us. And so Robert Wood Johnson, and I'm saying these things because they said it, they actually called us on it, and they said, you're bringing these people in, but we're noticing. And so I just say to you, as we celebrate and as we work together, let's really be intentional and look around our own offices, our own buildings, our own city, and look at who has the power to influence policy. Because I would submit to you today that the reason that the Brown Foundation is funding the Zones of Hope, connecting young black men to education and jobs, is because they understand that for so long they have been left out. And that is why we are focused so heavily in West Louisville. A red line map with what has happened in our city, and you will see so clearly how policy and law has influenced where we are. West Louisville is exactly where it ought to be, given all of the policies that have been created many, many years ago in order to impact that part of the city. The reason that the Humana Foundation is funding a health initiative, the reason that we are all here doing this work is because for years we have had policies in place that have not lifted people, included people. And so we all, and this mayor, this administration, is committed to change. And Robert Wood Johnson said we won because they know that we are willing to fight the good fight. They know that we are willing to partner. They know that we are willing to do something different. But it is going to take all of us after today really committed to walking the walk. I know this community. I love Louisville, Kentucky, and I think we are everything Greg Fisher wants us to be. And so I'm excited. I am so excited about what we're going to do next. Thank you very, very much for including the Louisville Urban League. And one day I'm going to be able to get up and give a speech about how great we are and how far we've come. It ain't today, y'all, but I appreciate it. Thank you.
Good morning, everyone. My name is Theo Evans, and I'm one of the co-founders of Ideas X Lab. And I'm going to share with you a little bit of the direct feedback this morning that we got from the Robert Wood Johnson Foundation, a little more detail behind this honor. So, Robert Wood Johnson Foundation is honoring Louisville as a community that is intentionally making health equity our compass. But we question what that may mean for many Louisvillians when sharp health disparities are more than data on a page, when it's actually their lived day-to-day experience. So the prize does not mean that our work is done. It is actually a call to action, an acknowledgement of our city's ongoing efforts to right historical wrongs and to combat conditions that are all too familiar to many in our city because of racism, poverty, and other bias. According to the RWJF prize selection team, there were 4 primary things that sets our city apart from all the other communities across the country that they saw. They are: 1, our focus on health equity, as championed by the Department of Public Health and specifically the Center for Health Equity. 2, how we're merging arts and culture with entrepreneurship for social change, as championed by Ideas X Lab. 3, our unwavering commitment to violence prevention, and this is championed by many people, including the Office of Safe and Healthy Neighborhoods, the University of Louisville School of Public Health's Commonwealth Institute, and Kentucky One Health. And 4th, our intentional efforts to lead with data-driven decision-making and collective impact. Many champions on this one: Greater Louisville Project, Community Foundation, Kentucky One Health, Humana, the Louisville Urban League, the YMCA Community Shield, and the Office of Civic Innovation, and the Institute for Healthy Air, Water, and Soil, and we really could go on and on with this list. Just a few of the examples highlighted by RWJF demonstrating our city's commitment to a culture of health are some of these. They said that we are building sustainable policies and systems, and they saw that evidenced by the University of Louisville's Center for Disease Control grant that establishes a youth-led model for youth violence prevention research, our new minimum wage ordinance, our smoke-free parks, new mixed-income housing developments like Smoketown Shepherd Square, and City Hall's efforts in working to make health in all policies a reality. They recognize that we are building on Louisville's historic reputation for innovation. They recognized social innovation is now taking place across many sectors in Louisville, and it's exceptional in its comparison to other cities. For example, our Center for Health Equity, the very first in the nation, is now 10 years old. And today, the Center for Health Equity continues to bring the democratizing lens of health to the conversation around race and poverty. Ideas X Lab, groundbreaking partnership work in merging together the cultural and health sectors through social entrepreneurship to produce measurable change in healthy communities, was highlighted by RWJF as an emergent national innovation model. In particular, they highlighted the Creative Innovation Zone with Youth Build, Roots and Wings with Bridge Kids International, and most recently, Project Hill, led by spoken word artist Hannah Drake. And lastly, they very much took notice of our emerging culture of compassion, as championed by Mayor Greg Fisher. And importantly, RWJF was deeply impressed with the way that Louisville is harnessing the collective power of our leaders in partnerships and communities. And of particular note was the way that we are using the county health model as a guide to our city's work, a data-driven approach being championed by the Greater Louisville Project. And it was also noted that GLP is perhaps a national emergent model that other cities could benefit from. Our commitment to collective impact is working. It's being championed by the Urban League, Kentucky One Health, Humana, Community Foundation, and many others, and it's resulted in Louisville having some of the most unique public-private partnerships in the nation, addressing a wide range of issues, including reducing chronic disease, establishing cradle-to-career models for education, increasing child protection, addressing violence, and these are just a few of the many others highlighted by the prize team. Louisville's strong focus on leadership development for youth is demonstrated by the work of Youth Build 55,000 Degrees and others was also seen as unique. And finally, the RWJF prize team noted how unique Louisville is in the entire country to have large health systems and insurers like Kentucky One and Humana who are making big investments in the social determinants of health. So this prize does not mean that we have perfected things. It means that our cross-sector efforts are beginning to be successful in reframing Louisville's health conversation. It means that we have a solid foundation from which we can build. And the building process with RWJF continues in October, when there will be 6 of us that will join other prize winners and Culture of Health Prize alumni in Princeton at the RWJF headquarters for 2 days of sharing and learning. And then in November, we will share what we have learned with the Louisville community. And all here and all across our city are invited to join us on Monday, November the 7th, at the Ali Center for an afternoon and evening of learning and celebration. We are calling it Louisville's Culture of Health, putting health in everyone's reach. And from 2 to 5 that day, we'll focus on learning from each other. And then from 5 to 7, we will celebrate the prize with an evening including performances by Louisville's based artists, where we can come together and honor the hard work that so many in our city have been doing for so long. On behalf of the prize application team, we want to thank all of the nearly 200 organizations who supported this process. And we hope that the Culture of Health Prize serves as a launch pad for bringing together new organizations, initiatives, and community members to collaborate and to pool resources and to devise new ways to infuse equitable practices into all of our actions. I'm an artist, And many often ask me, what role can artists possibly have to play in building a healthier city? And so to close, I will leave you with the words of poet James Baldwin. The precise role of the artist is to illuminate that darkness, to blaze roads through vast forest, so that we will not, in all of our doing, lose sight of purpose, which is, after all, to make the world a more human dwelling place.